For 70 years, the Mental Health Foundation in Scotland has been part of the UK's leading charity for mental health. Prevention is at the heart of everything we do. We aim to find and address the sources of mental health so that everyone can thrive. In 1949, Dr. Derek Richter established the Mental Health Research Fund, hoping to redress the imbalance between physical and mental health funding. After years of sharing research, tackling stigma and influencing government, the Research Fund merged with the Mental Health Trust to form the Mental Health Foundation in 1973. Today, our campaigns and programmes impact people of all ages and backgrounds throughout Scotland and the rest of the UK. With more and more school children struggling to cope with their mental health, our Make It Count campaign strives to give every child in Scotland an education with mental health at its heart.
The Make It Count campaign is responding to what our research tells us, that young people want to gain these mental and emotional skills. As a generation, they are interested in that. And so the Make It Count campaign came from both a need and a demand for change.
We work with refugees and asylum seekers to help them manage their mental health in a range of ways, from use of the arts to our innovative Community Conversations programme.
There's lots of research out there to say that the people that go through the asylum process continue to struggle with their mental health after, because it's a difficult process, it's traumatic.
What's really important for people is that the support network that they have is really crucial in terms of their mental health, because they're busy, active in the community, they're getting to know people.
If I was experiencing one thing, one of the women probably had already experienced that. We were helping and supporting each other, and that's why I decided I wanted to volunteer with the Mental Health Foundation.
It's My Life is a set of guided conversations with a support worker. It is a user-friendly tool that helps people identify and express what kind of support they need to make progress with their mental health.
It does focus your mind on what you've done and what skills you've used, what things have happened to you and how you've reacted to them. And it also does give you something to look back on and think, well, 3 months ago I was there and now I'm here.
Mental Health Awareness Week is our national week to inspire people across the UK. The theme for 2019 was Body Image, How I See Myself. One of this year's highlights was this spoken word poem from Priscilla Hernandez.
Look in the mirror with acceptance and resistance to everything this representation makes you feel. This is real. You are energy, powerful emotion. You are human, full of life and emotion. Not just an image of a body.
We believe the arts have a powerful role to play in challenging preconceived ideas about mental health. We run the Scottish Mental Health Arts Festival every year, and it continues to be one of Scotland's most diverse cultural events. 70 Stories was an online project from this year's festival, which connected stories from our writing competition into a compelling portrait of mental health in 2019.
We are never permitted to be human poets, writers, journalists, whatever. We are women poets, female writers. We are murdered women. We are statistics. We are problems to be solved. We are problems to be represented.
Our fundraising events are about more than money. At their heart, they promote community and supporting others. MHF Live encourages people to host their own live music event, taking the view that music is good for the soul and getting together is good for mental health. Tea and Talk has been running for 10 years, supporting people to put the kettle on and get together with friends and family to talk while raising valuable funds.
It's good to just take time out sometimes and sit down and have a chat. I think it raises awareness, it breaks down that stigma, it's okay to talk about these things, just go for it.
As we reflect on our achievements over the past 70 years, one thing is clear: our work is not yet done. We know that 50% of mental health problems are established before the age of 14, and that suicide is the leading cause of death for men under 50 in the UK. Working together, we can continue making a difference.